Do you think that the Quebec government overreached? And I'm going to pass it to you, Mr. Moore.
Absolutely. I mean, this is one of the most egregious charter violations we've seen, and it really harkens back, in my view, to the kind of coercive and dehumanizing government paternalism that has characterized some health interventions in the past. And I recently spoke, for example, with an Aboriginal elder who related how the Canadian government would force the members of his community to line up for medical tests and treatment just for them to receive their annual treaty stipend. And on that community, many of the members of that band, in fact, had decided, based on their own traditions and for their own reasons, not to get vaccinated. So when we're looking at the impact that this tax could have, we need to personalize it. We need to think of it not in the abstract, but how it will actually affect individuals, their rights, and their livelihoods. What kind of a negative effect will this have on the members of that poor First Nations community? And what kind of a negative impact will it have, not just economically, but internally, where it kind of harkens back to this paternalizing, dehumanizing government policy that's really dictating the medical choices of people with their own bodies.
Yes.
That is abhorrent to a charter perspective.
So I would say, would you think that we can characterize this tax as a behavioral or sin tax?
I think it goes so much further than that. It's not just talking about people's, choices with their pleasures. It's talking about people's choices with their own body and medical decisions. And again, the government doesn't know all the reasons or chooses to ignore many of the reasons why people are refusing to get these, whether it's a non-recognized medical concern, whether it's a traditional or religious practice. These are deeply held concerns and realities that people have, and to paint them all with a broad brush and say everyone who's not getting vaccinated must be taxed with a significant burden, it's just unacceptable and, in our view, constitutionally unjustifiable.
Agreed, but at the same token, the counterpoint argument is that, well, what about those who feel that the unvaccinated are causing an overdue burden to the healthcare system and to the rest of society, that the rest of society could be enjoying their lives, going to restaurants and doing the things that they wanted to do, but for the unvaccinated? Would you not think that that would be a good enough reason as well?
Well, I think that's a dangerous scapegoating that's been really played by politicians and some media that's not really grounded in reality. Of course, there's no constitutional right to healthcare. The government has chosen to provide this service. And now this service has been arbitrarily limited. If we look back to the 1980s, Canada had twice as many hospital beds. And so now this arbitrarily limited supply is being the token with which we are coercing and now directly mandating people's medical choices. That is not a justification to violate people's medical choices when the government's own failures to properly staff and requisition for healthcare spaces is really the cause of the problem. And I think the government is really deflecting blame for their own inadequacies onto a particular segment of society, which is increasingly looking like dangerous and discriminatory rhetoric, which is not justified in the science. I mean, we have to recognize, as probably Dr. Bowman can point out much better, the fact is that individuals vaccinated and unvaccinated can contract and transmit COVID. So we're not talking about, the panacea that's going to stop all transmission. We're talking about people who, for better or worse, are going to bear those consequences of their medical choices themselves, and to have the government putting this violation on them in addition, a financial penalty directly for their medical choices, just cannot be stomached from a constitutional perspective.
And I understand that, Mr. Moore, and I'm going to bring Dr. Bowman in. But the point of the matter is that you highlighted a very good point. At the end of the day, to use the pandemic and COVID as an excuse for the hospital shortages that we have is not a very good reason, because we were already having this. And in Ontario, Premier Doug Ford was talking about saying that he was going to get rid of hallway medicine. And hallway medicine was because a lot of hospital beds were here in the hallway and people were getting treated. So I understand that point, but there's other ethical considerations to consider. And Dr. Bowman, I'm going to bring you in, but we just make your quick point, because then we have to head to a break.
Yeah, another big one, and I so often say this, is where did Omicron come from? Where did Delta come from? It came from the fact that we have a global pandemic that we've done next to nothing about. and what Canada has said we're doing and what we're actually doing are two very, very different things. And so, we have a system that has no resilience within the healthcare. And look, I work in healthcare. I know how hard those systems are. But when you combine the big picture of we've done very little to deal with a global pandemic, our hospitals don't have resiliency, and we're doing this on top of it, I think it's very hard to justify.